Imagine waking up to a serene morning, birds singing in harmony and life appearing perfectly normal. But what if I told you that sometimes life throws unexpected curveballs our way? One such curveball is a heart attack. It can happen when you least expect it. Each year, heart attacks affect millions of lives. Unfortunately, not everyone makes it through. But it doesn't have to be that way. What if there were subtle signs, whispers from your body, weeks before the actual event? In this video, we're going to explore 12 of these early warning signs your body sends you a month before a heart attack. So without further ado, let's get started. Number 1. Chest pain or discomfort. Picture this. You're watching your favorite TV show, and suddenly, it feels like an elephant is sitting on your chest. You might experience a heavy, crushing sensation, fullness, pressure, or squeezing in your chest. This is not just any discomfort, it's your heart's cry for help. This pain occurs because the blood flow to a part of your heart muscle is blocked, usually due to a clot in a coronary artery. Your heart muscle, deprived of oxygen, starts to protest. And that's when you feel the pain. Number 2. Shortness of breath. Imagine climbing a few flights of stairs, and suddenly you're huffing and puffing like you just ran a marathon. Unexplained breathlessness, even without chest discomfort, is a cause for concern. When your heart can't pump blood effectively, it impacts your lung function. This can lead to shortness of breath. It's your body's way of saying it's not getting enough oxygen. Number 3. Pain or discomfort in other areas. Your heart doesn't play favorites with pain locations. Sometimes the pain or discomfort might radiate to the neck, jaw, shoulder, arms, or upper abdomen. It's your body's way of sending an SOS signal. This radiating pain happens because the same blocked artery that's causing chest pain can affect nearby nerves, creating pain sensations in these areas. Number 4. Fatigue. We all get tired, but when it's extreme and hits you out of nowhere, then something might be amiss. You might feel like you can't even get out of bed, let alone run a marathon. When your heart isn't pumping blood efficiently, your body isn't getting the energy it needs. This leads to fatigue. Think of it as trying to run a car with a clogged fuel line. It's just not going to work properly. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 5. Cold sweats. You're not in a sauna, but you're suddenly drenched in cold sweat. It's not because you're nervous, it's your body's way of responding to an emergency. When your heart is in trouble, your body goes into fight or flight mode. This can lead to profuse sweating, especially cold and clammy sweat. It's your body's way of trying to cool down and stabilize under pressure. Number 6. Dizziness or lightheadedness. You're standing still, but the room starts to spin or you suddenly feel like you might faint. It's a sensation of dizziness or lightheadedness that can be a sign of heart trouble. Reduced blood flow to the brain can cause this feeling. When your heart isn't pumping blood efficiently, your brain might not be getting enough oxygen, leading to dizziness or lightheadedness. Number 7. Nausea or vomiting. You might mistake this for a stomach bug, but sometimes it's your heart sending distress signals. Unexplained nausea, indigestion, or vomiting can be concerning. A heart attack can stimulate nerves that connect to your digestive system, leading to these symptoms. It's your body's way of saying, hey, something's not right. Number 8. Heartburn or upper abdominal pain. Chronic heartburn or upper abdominal discomfort might be more than just indigestion. It can sometimes be a precursor to a heart attack, especially in women. The same nerve stimulation that can cause nausea and vomiting can also lead to upper abdominal pain. It's your body's way of saying, listen up, something's wrong. Number 9. Unusual anxiety. You're sitting calmly, but a wave of extreme anxiety or an impending sense of doom washes over you. It's not just in your head. It might be your body's way of signaling distress. A heart attack can trigger the release of stress hormones. This emotional response can be your body's way of dealing with the physical stress it's under. Number 10. Irregular heartbeat. Your heart usually beats like a well-tuned metronome, but suddenly it's like a wild drum solo. Palpitations, skipped beats, or a racing heart can be signs of an underlying heart problem. An irregular heartbeat or arrhythmia can be caused by issues within the heart's electrical system. It's your body's way of signaling that something is amiss with your heart's rhythm. Number 11. Unexplained sweating. One day, you're sitting at your desk, and out of nowhere, you're sweating buckets, even though the room temperature is comfortable. It's not a response to heat, exercise, or anxiety. It's just an unusual, excessive, and unexplained sweat. This happens because your body's internal alarm system might be going off. When your heart is struggling, your body can react with excessive sweating as it tries to cool itself down. If you notice unusual and persistent sweating, it's a sign you shouldn't ignore. Number 12. Swelling in your lower legs, ankles, and feet. Imagine going about your daily routine, and you suddenly notice that your lower legs, ankles, or feet are swollen, even though you haven't injured yourself. It's not just a cosmetic issue, it could be a sign of an underlying problem. When your heart isn't pumping efficiently, blood and fluids can accumulate in your veins, especially in the lower parts of your body. This can lead to fluid accumulation and swelling. It's your body's way of saying, "Help, we have a problem here." In the days, weeks, or even months leading up to a heart attack, your body can give you these subtle signals, urging you to pay attention. Remember, it's not just about recognizing these signs, it's about taking them seriously. Your body might be trying to tell you something important. Don't ignore the whispers. They could be the key to your heart's well-being. So don't hesitate to seek medical attention if you or someone you know experiences these symptoms. Early intervention is the key to preventing heart attacks. When you arrive at the hospital or a medical facility with chest pain, shortness of breath, or any of the other signs we discussed, your doctor will conduct a thorough evaluation. They'll ask about your symptoms, medical history, and risk factors. This helps them determine the urgency of the situation. One of the first steps is often to perform an electrocardiogram. This test records the electrical activity of your heart and can quickly reveal irregularities that may suggest a heart attack. Doctors can diagnose which part of the heart is affected and how severe the damage is. Blood tests also will be done, as they can detect specific markers, such as troponin, that are released into the bloodstream when the heart muscle is damaged. Elevated troponin levels can confirm a heart attack. If you're in pain, your doctor will ensure that you're as comfortable as possible. Medications may be administered to relieve chest pain and relax your blood vessels, making it easier for your heart to pump blood. If the heart attack is caused by a blood clot in one of the coronary arteries, doctors may use clot-busting medications to dissolve the clot and restore blood flow to the heart. In some cases, a procedure called cardiac catheterization may be necessary. This involves threading a catheter through the blood vessels to the heart. It can help diagnose the blockage and, in some cases, open the blocked artery with a stent to restore blood flow. Other than these immediate interventions, doctors will discuss the best course of action for your specific case. Lifestyle changes, medications, and cardiac rehabilitation may be recommended to prevent further heart issues. Always remember, your heart health is something you should never take lightly, and taking proactive steps to protect it is a wise choice for a longer and healthier life. Now, we want to hear from you. Did you have some of these signs before? Was it actually a heart attack? Share with us your experiences and opinions in the comments below. We'd love to hear them. Thanks for watching.